Hey there, everyone! Welcome back to the channel. Today, we're diving into a critical issue that's affecting the Democratic Republic of the Congo, DRC, and its neighboring countries. It's a story that highlights the disproportionate impact of the Ebola outbreak on women and children, and it's absolutely eye-opening. So let's jump right in. First off, the Ebola outbreak in the eastern province of Ituri, in the DRC, is a devastating situation. It's not just about the virus itself. It's about the social and economic fallout that's hitting the most vulnerable populations the hardest. According to the UN, women and children make up nearly 80% of the displaced population in Ituri, and they're bearing the brunt of this crisis. Now, here's where it gets really concerning. According to the UN Children's Fund, UNICEF, children account for almost a third of all deaths, despite making up only a quarter of confirmed cases. That's a staggering statistic, and it underscores the unique vulnerability of children in this outbreak. But it's not just about the numbers. The outbreak is also disrupting essential health care services, which are already strained in the best of times. In the hardest-hit areas, the use of health services has dropped by more than 40% in recent months, as fear of infection keeps people away. Now, let's talk about the impact on pregnant women. The UN Population Fund warns that fear of Ebola and overstretched health services are preventing many pregnant women from seeking care. As a result, maternal deaths in Ituri have nearly doubled since the outbreak began, with an average of about 6 women dying each week from childbirth-related complications. And it's not just the mothers who are at risk. Ebola infection during pregnancy is associated with almost universal fetal loss. So what's being done to address this crisis? Well, the UN and its partners have deployed 13,000 community workers to reach more than 2.4 million people with messages on Ebola prevention and early detection. They've also carried out over 500,000 household visits to counter misinformation and encourage people to seek care early. But it's not just about the DRC. The outbreak is also posing a risk to neighboring countries like South Sudan. In South Sudan, the United Nations and partners are supporting government-led preparedness efforts against Ebola. This includes surveillance to detect cases early, screening at points of entry, training health workers, providing medical supplies, and community awareness campaigns. Health partners have screened more than 135,300 travelers at points of entry into South Sudan and trained over 300 health workers in screening, triage, infection prevention and control, referrals, and safe burials. However, insecurity continues to be a significant challenge. Between January and July, 451 incidents that blocked or threatened humanitarian operations were reported across South Sudan. Along the Yamarobo corridor, 32 humanitarian staff abductions have been recorded since January of last year, underscoring the challenges of operating in the areas at highest risk of Ebola. So what does this all mean? Well, for me, it raises a deeper question about the social and economic disparities that exist in these regions. It's not just about the virus. It's about the systemic issues that are exacerbating the impact of the outbreak. We need to think about how we can address these disparities and support the most vulnerable populations in these regions. In conclusion, the Ebola outbreak in the DRC and its neighboring countries is a devastating crisis that's disproportionately affecting women and children. It's a reminder of the importance of addressing systemic issues and supporting the most vulnerable populations in these regions. Thank you for watching, and I hope you found this video insightful. Don't forget to like, share, and subscribe, and stay tuned for more content like this.